What is an IGRA TB test and how does it work? Imagine a simple blood test that can tell if your immune system has ever fought off tuberculosis bacteria. That's what an interferon gamma releases assay, or IGRA, does. It's a modern way to check for tuberculosis infection by measuring how your immune cells respond to specific parts of the bacteria. Instead of waiting days or weeks for a skin reaction, this test gives quick and accurate results from just a blood sample. The main goal of the IGRA test is to find out if someone has a latent tuberculosis infection. That's when the bacteria are in the body but not causing symptoms or illness. It can also support diagnosing active tuberculosis in some cases. The test is especially useful for people who have received the BCG vaccine, which can sometimes cause false positives with traditional skin tests. Because of its high specificity, the IGRA reduces the chance of false alarms caused by prior vaccination or exposure to other non-tuberculous bacteria. Here's how it works. A healthcare provider takes a small blood sample from your arm. The blood is then mixed with synthetic peptides that mimic to specific proteins found in the tuberculosis bacteria, called ESAT6 and CFP10. These proteins are unique to the bacteria that cause tuberculosis and are absent in the BCG vaccine strain and most other environmental mycobacteria. If your immune system has been exposed to tuberculosis, your T cells, white blood cells that help fight infections, will recognize these proteins and releases a signaling molecule called interferon gamma. The test measures this interferon gamma either by quantifying how much is released or by counting the number of T cells producing it. There are two main types of IGRA tests. The first is the QuantiFERON TB Gold Plus, which measures the amount of interferon gamma in the blood after stimulation. The results are reported as positive, negative, or indeterminate. The second is the T-Spot TB, which counts the number of T cells releasing interferon gamma, giving results as positive, negative, or invalid. Both tests are quick, usually taking a few hours, and only requiring one visit for blood collection. Interpreting the results is straightforward but important. A positive result indicates that your immune system has been exposed to tuberculosis bacteria, meaning you might have a latent infection or active disease. A negative result suggests no evidence of infection, but in some cases, especially if your immune system is weakened, it might not detect an infection. An indeterminate or invalid result means the test couldn't be properly interpreted, and a repeat might be necessary. Compared to the traditional tuberculin skin test, the IGRA offers several advantages. It only needs one visit, as it's a blood test, and it's not affected by prior BCG vaccination, which can cause false positives with skin tests. It's also more specific because it targets antigens not present in most environmental bacteria or vaccines, reducing unnecessary follow-up tests. However, it's important to remember that an IGRA cannot distinguish between latent TB infection and active tuberculosis disease. If the test is positive, further clinical evaluation and additional tests are needed to determine if the infection is active. The test may be less reliable in young children, people with weakened immune systems, or those recently exposed to TB, as their immune response might not be strong enough to produce a positive result yet. In summary, the IGRA TB test is a powerful, scientifically validated tool that detects immune responses to tuberculosis bacteria by measuring interferon gamma releases from T cells. It's a valuable part of TB screening and diagnosis, especially for those vaccinated with BCG or needing a more specific test. Always consult healthcare professionals for interpretation of results and further evaluation, as TB diagnosis involves a comprehensive approach that considers clinical signs, other tests, and individual health factors.